Welcome to my YouTube channel. Today we'll talk about cancer of the colon and the rectum. These are parts of the digestive system, the terminal end of the digestive system. So we have, when you eat food, it goes through your esophagus, it goes to your stomach, then the small intestines. From the small intestines, it gets into the colon. The major function of the colon is absorption of water from the food that you take and eventually elimination of waste via the rectum out through the anus. So the colon and the rectum can be able to get cancer. In Kenya, we have quite a number of patients who have colorectal cancer. So this is a matter of concern and we need to discuss it. So many would ask, how would I even think? What are some of the symptoms of colon cancer? So one can be very vague, like fatigue, change in bowel habits, noticing that you're not passing stool as well as you could. Others report bloating, while others have no symptoms at all. This really emphasizes the fact that it's important to go for screening. Others notice blood in their stool, or they may have anemia, low HB over time because of a tumor that is bleeding slowly over time. So this emphasizes for us to really know about cancer of the colon, it's important for us to have screening. Many guidelines have been put in place, and different countries in the West have some quote 45 years, others quote 50 years. So if you're 45 years or 50 years, it's important for you to go for what is called a colonoscopy. This involves inserting a camera through the terminal part of your digestive system to visualize, to be able to see through the rectum and through the colon. What are we looking out for? We're looking for growths that could be within the colon. Maybe you have several polyps, which are a risk factor to getting colon cancer. So some people have hereditary polyposis coli. So when you look at the colon, you see many villi growing within the colon. We also look out for skin changes, color changes of the mucosa or a mass. If we find a mass, remember in oncology we say tissue is the issue. A small biopsy is taken so that it can go to the pathology lab for us to examine it and confirm whether cancer cells are there. So what are some of the risk factors to developing cancer of the colon and rectum? One can be things we can change. For example, our diet. Taking diets that are rich in toxins, for example, taking nyama choma that is charred meat is carcinogenic. We've always been talking about having food that is rich in fiber to ensure you have at least movement. So another risk factor we can talk about is age. We mentioned that majority of the cancers are in people above the age of 50, hence why we start screening at that age. Another risk factor is obesity. It has been shown to be a risk factor for colorectal cancer. I think discussions surrounding oncology would not be complete if we do not talk about the role of cigarette smoking. Its effect has been seen more stronger when we are talking about rectal cancer. And also, having food that is rich in fiber has been shown to reduce the risk of having colorectal cancer. Remember, there is a hereditary portion to it. So if you have had a relative, a close relative, a father, a mother, a brother, or a sister in the nuclear family or even the extended family that has had colon or rectal cancer, it's important for your screening to start 10 years before the age of that relative's incidence. For example, if my relative had colon cancer at the age of 40, then I would start getting screened at the age of 30, 10 years before the onset of the cancer. Why is screening for colon cancer very important? It is because from the start of the tumor formation to when you have overt disease, there is a very long latent period, meaning we have so many chances of catching it before it becomes invasive disease. So what do we recommend? Go for a colonoscopy. Are you 40 years old? Are you 45 years old? Are you 50 years old? Have you had your colonoscopy this year? Kindly ensure you go for a colonoscopy. Early detection saves lives. So what are some of the treatment options we have? For colon and rectal cancer, we have many modalities for treatment based on stage. The modalities can include surgery at the beginning or after chemotherapy to shrink the tumor. We can also have chemo, its role being to shrink the tumor to enable easy removal of the tumor by the surgeons. For the rectal cancer, then we can have surgery as an option, chemotherapy, and also radiotherapy as a treatment option. Treatment options are present. Thank you. See you during the next cancer awareness discussion.